is only as good as your data. And I think in any individual practice, a group practice, in a unit practice, department practice, my own approach has always been to have world-class data collection. Your data has to be collected in a very systematic manner, in a trustworthy manner. The unit chief or the academic chief, whoever that person would be, needs to also verify that the data is being accurately collected in a timely fashion, because we don't then rely on our memory of what happened with certain outcomes. Because clearly, when you're doing outcome based research, the data is very, very important. So, how do you maintain your data? Who is your person? Is there a group of people you entrust? Do those people change? How does that work?
Yeah, so the very important point that you mentioned here is the quality of data and the authenticity of data. We have to be very, very clear with that, because it is very easy otherwise to get driven and biased and publish something which by tampering the data, that should never be something which can be even remotely thought of. So what we do is we have a structured data entry which is done by the senior fellows in the unit, which is periodically reviewed, and also a thorough check is done at the analysis level by the data scientists as well, where we keep going back and check it again. Of course, if you have a central data, that becomes easier, which can automatically gets captured into the databases. But what we follow here is a manual entry into the SPSS sheets,